The pandemic has forced a lot of healthcare providers to change how they provide care and interact with patients. And as Abigail Vaerewyck reports for the VA system, which treats millions of veterans every day, the change has had some positive impacts.
In mid-March, the Phoenix VA opened up COVID vaccinations to every veteran covered under the system. It's a big effort, but Dr. Leslie Lockridge says one thing the pandemic has done is force the healthcare system to adapt and change.
We have made leaps and strides that in this past year that it probably would have taken us years to do outside of this pandemic, because it was a forced change. But we've seen a lot of positive things as far as how we're able to provide care because of that.
Ramping up vaccinations is just one change. Telehealth has made a big impact during the pandemic. Now, virtual appointments are used for more than just physical health. They allow veterans to connect.
I think really the challenges that the pandemic's brought on is just a more sense of isolation, right? We get isolated, and that depression, the studies have already shown that more and more Americans and veterans are falling into depression because they don't have those outlets that they used to have, or that connections that they used to have.
According to a study from the U.S. Department of Veterans Affairs, veterans are 1.5 times more likely to die by suicide than non-veterans. And the VA isn't the only system changing how they help veterans. Private organizations like the Boulder Crest Foundation are using alternative therapies to help with mental health issues.
It is a deep dive in the science of post-traumatic growth. We teach about 33 or so different wellness practices to teach people how to self-regulate so they don't self-medicate.
Josh Morris says the program has helped him reconnect with his family.
And I knew I was having trouble connecting with other people, and it started to allow me to rebuild those bridges.
From families to healthcare, the pandemic has encouraged a lot of bridge building. In Phoenix, Abigail Vaerewyck, Cronkite News.